Hi everyone, my name is Vaishali Jha and I'm the founder and president of Karijana. And here I am today with Agam, who is a UCLA undergraduate student.
Hi, happy to be
Happy to
here.
be here. All right. I guess I'm really been inspired by your work in healthcare disparities and also just like providing service to the community. I guess what specific goals and aspirations drive the work you engage in?
I think there's a lot of different aspects just because when you talk about health, it's just so wide spanning. For me personally, it's been a lot about wanting to make sure that education is offered in a way that is very skills based, and also is able to be communicated to everyone, in a way that's empowering to them. And instead of seeing health as sort of like a chore that we have to go through, it's really something that we can integrate into our daily lives and feel confident and again like empowered by. And so like that's been a lot of like my ultimate goal throughout the amount of service I've done, and in different ways I've tried to take part in health initiatives. And it's hopefully something that I get to continue to do in the future. It's things that I've been really passionate about as well.
Are you looking forward to like pursuing like med school and other stuff as well?
Yeah, I'm actually looking to go on like the PhD or like research route.
Oh.
Just really wanting to understand like population specifically. Like I feel like being a brown girl specifically, it's just been you don't always see research that's oriented towards your community. Um, and in a space where there's a lot of brown people that I know, my family, like communities that are just not being represented in the health that we see and in the health education that we see has always been kind of something that's like irritated me in a lot of ways. Um, so that's something I hope to like get to research more about and be able to create like educational curriculums on in the future.
Sounds really amazing. I guess, would you like to share a deeply personal story that inspired your involvement in this service work? Like, as you mentioned, growing up like as a South Asian. So, I guess what inspired you specifically?
Yeah, definitely. I think a lot of it comes from the fact that I moved around as a kid a lot. I was actually born in Canada, moved around in communities there, came down to California, and moved around a few times, and now I'm like just even more so in LA. But in all of that moving around, especially in making that change from Canada to the US, the first community that I came in, I was maybe one of like five South Asian kids in our class. And just not seeing that representation that I sometimes had a lot of in Canada was a huge change for me. And in adapting to that and also trying to understand like how do like learn more about my heritage, and how that fits in with like the health curriculums in class when things don't align culturally or there's just things that like for example if I'm eating my roti at home like that's not necessarily represented in when you're like recommended to like have brown bread or something like like things like that that are small but also really like integral to our daily lives. I think wanting to see more of that was something that got me started in the beginning, just in health in general. And also it's been things like our grandparents have always like lived with us. So I consider like my family to be like six people. And I've always been like the one that's like taking them to doctor's appointments or like been there as like a translator. And seeing how there was so many cultural differences in the way the doctor understood kind of what I was saying in English versus what my grandparents were telling me in Punjabi. Like just seeing that gap has just been another thing that I've wanted to work to address.
Wow. Yeah, I mean, I'm also like I kind of feel that on a daily basis too. Like sometimes when I have like non-Indian friends ask me like what I'm eating or why I'm styling my hair in like a certain way for like dance performances, it's like really hard to just explain
Mhm.
using English words. It's like, oh, yeah.
Exactly. I
Yeah.
totally get that. Like, there's not always the English word for what your culture is, and I think that like creates a communication gap. But I definitely think that there's a way to normalize more of our culture and into like integrating it into like the American society as well.
Yeah. And I guess kind of like reflecting on your like work in like, advocating for South Asian representation in healthcare. What are the most like very hard challenges you've encountered and how have you like navigated through them?
Yeah. I think there's a couple different things. I think a lot of it is at like the bureaucratic level of like when, for example, I have taught education, or I've taught in 12th I was 12th grader in freshman classes in high schools, and being able to even do that takes a lot of like going through what the district wants. And like one time we wanted to conduct a survey among students in classes in their health classes, and we weren't able to do that because the district had all of these like policies that they weren't necessarily wanting to mend over or like that bureaucratic level can always be something that stops you. But I think at the end of the day, I was able to teach the classrooms and like create new curriculum by talking to the health teachers and like working a way around that. And in the end, it was really nice to be able to teach. Specifically, I was talking about tobacco use, but all talking about it from a environmental perspective, from like a physical health perspective as well with actual like dissections in class. So people can get like an in-depth look of like, what we're actually talking about when we say the effects of health on like firsthand, secondhand, thirdhand smoke. And also like the industry accountability aspect. So really wanting to take like a wide angle so that we have all of this information that can be disseminated to freshmen and empower them to like make those choices for their health into the future as well. Um, so I guess like, the bureaucratic level can always be kind of one of the hardest ones, and it kind of comes back to like the communication gaps that exist between maybe values that youth have versus um, officials at the district levels and above.
Mhm.
But I think you can see that kind of anywhere, and there's ways to get around that through protections and further advocacy and just different communication perspectives.
Mhm. Yeah, I guess like as well for like my nonprofit, we work on just like kind of like helping the foster care system. So kind of just like providing mental health services sometimes or just like resources and supplies. So yeah, I agree. The bureaucratic level, it can get really hard kind of like dealing with I guess we tried to assign like a few service programs with the mayor and that took a long while, but yeah.
I understand that. The policy level especially can be really hard, but I think over like my advocacy, I've seen a lot of it come to fruition, like through a lot of like collaboration, and like just continuously pushing. And I could get into that later, but you can continue as well.
Yeah, I guess what novel approaches did you like take and how did it confront all these like social issues that you wanted to like deform?
Yeah. One of the ones I would say that I did a few years ago was a documentary. And this I would say was probably one thing that I didn't know was going to be as big as it ended up being. Because I originally wanted it to be something, it was during COVID, so we didn't have a lot of means of communicating with like one another. At the time, I was working at on SB 793, which is a bill to basically limit the amount of flavored tobacco products that are sold and marketed to youth in the state of California. And since that bill had like kind of taken like it was slowed down because of COVID at the time. And so I wanted to create a documentary to push a like lawmakers in the country or in the state specifically on why they should be focusing on this, why this is so important, how it's even more relevant during the time period we're in, and then also talking on like the national level as to why this is something that's not just relevant to California, but to the entire nation. And so it eventually ended up that documentary ended up winning a documentary competition. But what I didn't realize is that it was going to be used at like policy hearings in states that I had never even been in before, or be viewed globally because other countries have been trying to push these policies and never saw like the advocacy to be able to do that or how to communicate that to lawmakers. So I think that initiative really taught me that, first of all, like documentary and like filmmaking was something I'd never gotten into before, totally took a chance on, and having it have worked out like really goes to show that if you just like try and do something about a problem that you see, it could go way farther than you might ever imagine.
Wow, congratulations. I guess when you were constructing the video, were there any like thoughts that you had that like I guess um Sorry, let me rephrase this.
Hmm.
I guess like when you were constructing it, what specific like data or like what did you like format it is like I guess what was the content, I guess?
Yeah, so since it was the motivation of it was to like back the bill that was going on, the documentary title is Big Tobacco Bigger Epidemic. So really talking about how corporations have had this control on social norms and dictating our health for so long. And I used like interviews with policymakers, with researchers, one of them being Dr. Halpern Fowler at the Stanford Reach Lab. She's just been such a pioneer for this work and such a great advocate for this work as well. And really just like understanding their perspectives and putting in a lot of their work and what they've said and how that supports youth advocacy and how that can take like the next step in policy making and further as well. So that was kind of how it was constructed. And when I was interviewing like a lawyer for one time, he's a public health lawyer, or still is a public health lawyer, and I was interviewing him, and things were just going over my head. Like a lot of the words he was talking about, I was idea what this means. But afterwards, like looking at that recording, going through it piece by piece, understanding it, doing research on like what does this word mean, how does it fit in, like it just all made sense at the end of it. Like yes, it takes the time and like trying to figure out what things are that you have no idea of beforehand, but all of that work kind of leads into something that then you can communicate to other people in the way that you understood it best. So I think that was one of the biggest learning experiences that ended up shaping the documentary for me.
Wow. And I guess like as per relating to like civic engagement, what insights would you impart to individuals who would like to like have similar paths in service or even leadership in certain positions?
Yeah, I would say like first of all, I think sometimes I come across as someone that is very like leader-like, but I would tell you that I am an introvert at heart. Like it's not something that necessarily always comes natural to me, but it is something that when I'm really passionate about a topic or wanting to fix a problem, like it's very intuitive for me to just go all in. And I think I would recommend that to everyone as well. Like don't let anything stop you from wanting to fix a problem that you see a clear solution for or that you're figuring out a solution for, whether that means like putting in extra work to even understand what like the basic concepts of the problem are or talking to people that like professionals, like especially and I would also say that you can do this at any age. Like if there's not an age barrier to advocacy. Everyone should be involved. All of the voices that like go into fixing a problem really create like a comprehensive solution. So definitely go all in.
Yeah, I guess I would agree too. Like, and I guess like, yeah, I'm an introvert too, so I guess just learn to be spontaneous and really, as you mentioned, utilize your resources. Because for my own nonprofit, I just kind of network with my dad's friends and like everyone in my community. So, it takes a community to really make social impact happen. So,
Definitely. And like take and like even utilizing the community is also so empowering because then it's like all of us are in this together and we're all solving this problem with each other's help. And I think that is just so much more impactful than like going on it about yourself than like trying to figure out things just as like one person.
yeah. I guess, do you have any last messages you'd like to share to our viewers?
I again would just say like don't be afraid to go all in. Like it's always so empowering to meet people that are really passionate about the work that they do. And if you see a problem in your community and you want to go to solve it, like go to solve it. Like there are things that can come out from that you never know where they might lead. So I definitely would love to see more youth involved in advocacy and things that they're passionate about.
All right. Thank you so much, Agam.
Of course,
And
thank you
thank
for
you.
having me.
All right.